Allergic reactions can range from an irritating itch to a fatal outcome. But knowing how to handle such an emergency can make the vital, sometimes, the life and death, difference. One peaceful Sunday afternoon, you're dozing comfortably in a deck chair when a sudden scream fills the air and your kid brother, running towards from the direction of the public garden, crashes into your solitude. Your blood runs cold, his face is all red and swollen, and he's gasping for breath. A bee has stung him and he's one of those few people who are highly allergic to bee venom. What do you do to treat an allergic reaction, whether it's caused by a bee sting or fresh strawberries and cream? Even if you're a novice at emergency care, our step-by-step guide will tell you what needs to be done before you can reach a doctor. What happens, and what exactly happens in an allergic reaction? An allergy is an overreaction of the body's defense mechanism to the introduction of a foreign substance. The symptoms include intense itching, swelling up of body parts, watering of the nose, and breathlessness. Allergies are of several types, including delayed and chronic ones, but the present article is limited to the management of immediate types of hypersensitivity reactions that can cause a lot of damage in a short time if not treated promptly and correctly. Materials that can cause such severe, immediate allergies include different kinds of proteins, edible, such as eggs and dals, as well as those used locally. Anti-serum, snake venom, tetanus, rabies, etc. Hormones, enzymes, venom, bee and hornet stings, etc. Pollen extracts, foods, milk, eggs, fish, wheat, strawberries, chocolates, etc. The symptoms. Some common signs of allergy to look for are, system-wise, skin flushing and redness. Itching. Urticarial, large, irregular, raised patches with redness and itching. Swelling of the skin over part of the body. Bite marks or sting punctures. Eyes, redness. Swelling. Itching. Watering. Respiratory tract, sneezing. Watering of nose. Coughing. Breathlessness. Choking. Tightness in the chest. Suffocation. A sense of something stuck in the throat. Inability to talk. Gastrointestinal, vomiting. Diarrhea. Pain in the throat. General, anaphylactic shock, manifests itself in swelling of the face and body, sudden sneezing, dizziness, restlessness, nausea, suffocation and panic and unconsciousness. These symptoms can occur one after the other rapidly and the patient can die in minutes if emergency measures are not started at once. It is not necessary that you will find the symptoms of only one system in an allergy. A mix of symptoms may be found. Here's how you deal with individual allergies. Source-wise, animals. A person can be allergic to the dander, that is the fine scales and dust of dried up skin and hairs on an animal, and can react violently to this alien protein. Cat especially can bring on a violent reaction, most commonly, rhinitis, watering of the nose, and asthma, or breathlessness, which could become severe. Some people are allergic to an animal's saliva. Remove the offending animal from the victim's presence, and take the sufferer into an open area where he can breathe in fresh air. If he's been licked, immediately wash the area with soap and water. Brush off all telltale traces of the animal's hair from the person's clothes. If the contact has been longer and the victim is sneezing or coughing violently and getting more and more breathless by the minute, give him an anti-allergy pill and take him to a doctor.